Ah, today I'm here with Dr. Hyla Cass, and she has been one of my mentors. I've admired her work for years, again, spearheading the area of functional medicine and psychiatry, and always on the cutting edge, right? You never cease to stop amazing me, and also to come up with the next thing. So I want to talk about that with you today.
Thank you.
Absolutely. So tell me, what was your pearl take home from our functional medicine conference today? And also, what I really like to talk about, what you've now integrated into your psychiatric practice that's making a huge difference in healing your clients.
Great, love to. Well, what's so exciting is I've been in this field for many, many years, as you say, and 1,400 health practitioners at a conference, and they are so enthusiastic. People are rushing into the meetings. There's a break, and they go out for the break, and they rush back in, and I'm so excited. And the talks are so sophisticated, and what the talks are about are all biochemical individuality, how we're all different. There are a lot of similarities, but we have different things going on in each of us, and how to determine that, how to do lab testing, taking a history. There's so many ways to find out what's going on with you, and then what to do about it, all the different solutions. And again, very advanced. It's hard to believe that this isn't mainstream yet, but it's moving that way. It's very hopeful.
Yeah, and the fact that we've had so many other disciplines that are part of our functional medicine conference, which I love that, because psychiatry, GYN, body ecology, I mean, we've got a whole...
nutritionists, health coaches, everybody, because we are a team. We need everybody to get on board. So this is very cool. Another really big thing is with autoimmune disease, dealing with the gut. And similarly, as a psychiatrist practicing functional medicine, I'm always looking at the gut too, because the gut-brain connection is very powerful.
Talk about that a second, explain that, because that is so powerful, because even it was just until recently that it's become into the awareness, the gut brain, right? We're talking about the gut brain and how...
Well, we always knew there was a connection. You know, people with serious gut problems like Crohn's, ulcerative colitis, always had depression and anxiety, and they'd say, oh, well, you're just anxious because you have ulcerative colitis. Anybody would be, but that's not it. What's it is the inflammation in the gut is affecting the immune system, affecting the neurotransmitters, and most of the neurotransmitters are made in the gut. And even if they don't cross the blood-brain barrier, there's an influence of those neurotransmitters and the microbiome, because the microbiome is actually the microbiome are all those wonderful bacteria that live there, 4 or 5 pounds in our gut. So they are sending messages to the brain. So it's a very sophisticated, I mean, we don't even know how sophisticated the system is. And by treating the gut, I'm doing a lot of psychiatry. So it's kind of sad that people go to their doctor and say they're depressed, or say it's a menopausal woman, perimenopausal, anxious, depressed, here's your prescription. Now, as a psychiatrist, I'd say I'm a non-drug psychiatrist, because what I do is look at the gut, look at hormones, and treat accordingly. And then the issues go away, the mental issues go away.
Let's talk about that. Give an example of like a clinical scenario, someone coming into you and...
So, I mean, just about last month, I had a woman come in who, again, anxiety, depression. Her doctor wanted to put her on the pill because she was menopausal. I said, the pill, that doesn't give you any hormones. It takes away your hormones. So I tested her for her hormones, and also did some microbiome testing. Ended up putting her on bioidenticals. So doing like a functional
stool analysis? Is that what you're doing for microbiome? Okay.
Yeah. So I did that, put her on some hormoons, put her on progesterone, estrogen, DHEA, testosterone, based on her own needs. Yes. And saw what was going on in her gut and treated that accordingly. And she stopped being anxious and depressed and felt a lot better, had more energy. And then we began to deal with her weight, because your weight just goes south when you're all out of balance. So this is pretty typical. You know, and that's what you're doing too.
It's so fascinating too, and just in just understanding the gut-brain connection and how we really do. In functional medicine, we're big on that digestive stool analysis. We can look at bacteria in the stool, parasites, yeast, as well as in the urine. So urinary testing for microbes, digestive stool testing for microbes. That is really valuable, and I think that's one of the hallmark tests that can really, if you're struggling with any psychiatric disorder, you need a stool analysis, because like you said, the brain gut connection.
Yeah.
And so
and by the way, there are also amino acids and other supplements that you can take to help the brain, because to make neurotransmitters we need certain amino acids. So I actually have put together some brain formulas, one for focus, one for calm, that's what they're called, a focus and a calm, one called a brain cell support plus, because as we get older, sadly, our memory starts to go a little south. So by taking the, it's actually called brain cell support plus, it has products in it that support brain memory, cognition, so you can get your thinking back, which is really so good. Important. So when you go into a room, then you remember what you went into that room for.
And you can see that transition, and that is so important. So those amino acids, those nutrients, that especially when we're having a dysbiosis, we're not making it. So utilizing it. So empowering that aspect's just like a huge amount of support. You've come up with a lot of great formulas. You've been one of those innovators in brain health formulas.
I had to invent them because they weren't there at the time, and they're still really, really good. And every once in a while I tweak them. I always improve them following the science. And I have loyal customers for years and years. And the other thing that I'm finding really exciting is specific microbiome, specific bugs that do have certain effects on the brain. For example, there's something called target GBX. So what does that mean? Target gut-brain axis.
Okay.
So there's a probiotic by Claire Lab that does that.
Which is that one?
It's called Target GBX.
Okay.
And I actually carry it on my website because so many of my patients are using it. And what it does is it helps balance your brain. So if you have a little anxiety and depression and you can't quite put your finger on it, but you're not stressed, I've given it to people even that didn't realize that they were that stressed or anxious. And they said, wow, I feel more focused, I get more done, and I have better poops. So that's what the microbiome does. It actually does comprise a great deal of our poops and makes them better.
Yes, what comes in must go out, and it better go out healthfully. So that's very important. I always remember asking my patients, do you have constipation? They're like, oh no. I'm like, well, how many bowel movements do you have a day? Like a day, one a week. I'm like, that's constipated.
Wow, people don't get it. We don't talk about it.
We don't talk about it, and plus we don't know if it's normal for them. That may have been normal for some clients 30 years. That was their normal pattern. And so understanding that, okay, well, in order to have healthy hormone balance, you have to have healthy bowel movements on a daily basis, and how important that is. You're always the referral psychiatrist, right? You get the toughest of the tough cases. And now you've been also using CBD oil and Charlotte's Web, and I want you to talk with us about that and how you're using it. I
actually have my own CBD product.
Oh, okay.
Which is again on my website, because what I do is and Charlotte's Web's a good product too, a little pricier I think, but good.
Okay.
And there are a number of other good products around. What I do is I search for what I consider the best non-GMO and having the right concentration, where I can control what kind of concentration it is. I find that people need more than they think they do. So I'll put someone on CBD when they have anxiety, depression, inflammation. I give it to a friend of mine who had sciatica, cleared it up. And he has to keep taking it because the inflammation will recur, but it's because he has nerve root pressure from discs. But as long as he's taking it, he's fine and he doesn't have to take narcotics.
So how does the CBD oil, that's fabulous, because then also you've been using it to get people off Narcotics and opiate addiction, which we know is epidemic right now in our country, tragically so. And so, so using it for opiate addiction, but how is it working as an anti-inflammatory?
Well, it's doing, CBD it's cannabidiol, And when people first hear about it, they think, oh, well, I need a prescription, I have to go to a dispensary, because it's confused with marijuana because it's the hemp plant. But it's the part of the hemp plant that doesn't have THC in it. Now, there are CBDs that have low-dose THC in it. I don't want to carry those because some people are just very sensitive to THC. So CBD is actually very useful for getting people off of THC. And that's because the THC that's been bred now is very, very potent. So in order to get for people to get up very high. But if you want to use it for all these other purposes, you don't want to get high. You just want the therapeutic effect, which is just the CBD. So that's, I'm using the CBD. And how it works and why is it such a panacea? It balances hormones. It balances neurotransmitters. It's anti-inflammatory. Like, how can one thing do all of that? It's like, is this snake oil?
Right.
Well, it isn't snake oil. Maybe snake oil's good. We don't know. I read an article once that snake oil was actually okay. Anyway, I mean, it actually had some therapeutic effects. But the point is, there's something called the endocannabinoid system, and I won't make people spell it. The endocannabinoid system exists throughout the whole body, and we didn't used to know about it. And a scientist in Israel, Dr. Raphael Meshulam, researched it for 30 years, and he's still doing the work. He discovered anandamide, which is something we make. So we actually make our own CBD and THC, but we need help to make it work properly. And the help that we get is from the plant. Now it's from the hemp plant. There are other plants coming up that we're discovering also stimulate the endocannabinoid system. So now that hemp is more available and CBD is now legal in all 50 states, we take the CBD and it will wake up the endocannabinoid system. And then it can go to work. Balancing, it's like an adaptogen. It balances the hormones. If you're too high here, too low here, it'll balance it. It's a whole system of checks and balances.
Just improving the quality of life, right?
And the neurotransmitter effects are great.
So we're seeing effects on serotonin,
GABA, dopamine, acetylcholine, and ones we don't even know about.
Right.
Just because I'm not mentioning them doesn't mean CBD doesn't balance them.
Okay.
So it's quite remarkable, and really the proof is in the pudding. So I've been giving it to patients, and it's so working. Now, one of the things I do is take people off of psych meds, and you know that very, very few psychiatrists will tackle that.
Yes.
They don't want to. They say to the patient, "You're on an antidepressant. It's for life. That's just it. That's your, whatever. That's your condition." That's not true. So in order to come off, and never just go off cold turkey.
No, right.
Never.
Thank you for saying that.
You go off very gradually. Right. So when I take somebody off, say I'm taking somebody off an SSRI like Prozac, Zoloft, Celexa, I'll give them some 5-hydroxytryptophan, some essential fatty acids, maybe inositol, maybe GABA, but I'll also very purposely add in CBD because that's going to modulate the whole orchestra. And it's fabulous because it helps all these other ones work better, and I can get people off medications faster, I can get them off opioids faster, I can get them off THC faster. Because the THC now is making a lot of people anxious, even violent. And that's crazy because it used to be kind of like chill with THC. Well, when you have it mitigated and balanced with CBD, yes, it can be really good. But the very high THC levels now, for a lot of people, it really doesn't work well.
And plus, the CBD is what's adaptogenic and therapeutic, and we're seeing those differences in a balancing, holistic way that's working with our own endogenous processes, our own body systems, and that makes more balance. Hyla, tell people how they can get a hold of you and learn more about you, because she's a wealth of information, always.
Thank you. My website is cassmd.com, CASSMD.com. I have a store which carries all the products I've talked about, and I have a blog, newsletter, so you can sign up for my newsletter and you get a free ebook called Reclaim Your Brain, which talks a lot about the amino acids and vitamins that you need to make your brain work better.
Plus you have a couple books.
A lot of books.
A lot of books. A lot of books.
Thank you.
And is that available on your website or Amazon?
Yeah,
both?
they're listed on the website. Some are also on Amazon. So my latest one is a little book, a really tiny book. It's called the Itty Bitty. It's the amazing Itty Bitty Book of Cannabis.
Okay.
It's a part of a series of itty bitty books that are not. It's not my series,
Mm-hmm.
but I did this for the people who do the itty bitty books. So it's quite simple, but it explains it in a very easy to understand way, and it's on Kindle.
Okay, very good.
So,
Well, thank
on
you.
Amazon.
Always on the cutting edge. Always.
Thank you. Thank you so much.
Oh, it's great.
Pleasure.
Thanks for doing this.
Okay.